pass on to Beth for the disability toolkit.
Thank you so much, Amy. Lauren, please can I have my first slide? Thank you so much. So firstly, the definition of a disability. So under the Equality Act, a disability is a physical or mental impairment which has a substantial and long-term negative impact on a person's ability to do their normal daily activities. Just to expand on this, by substantial, the act means that it's more than minor, so it might take somebody much longer than somebody else to complete a daily task, with an example being getting dressed. By long term, we mean that it lasts 12 months or more. Some conditions such as cancer or HIV are these people automatically meet the definition of having a disability under the Act from the day of diagnosis. And there are particular rules around conditions which may reoccur or be fluctuating, such as arthritis. The Act states that if the condition ceases but is likely to recur, it might be considered to be continuing in those circumstances. It's also important to say that some conditions are not regarded as disabilities, an example being an addiction or dependency on alcohol or other substance use, other than when this is in consequence to being medically prescribed. Next slide, please, Lauren. The census showed that across England and Wales, 17.8% were self-reported as having a disability using the definition of the Equality Act, and 82.2% did not have a disability. That 82.2% is higher than in Birmingham, where only 80% didn't have a disability. And in Birmingham, 9.6% reported a disability, with their day-to-day activities being limited a lot, and 10.4% with their day-to-day activities limited a little. Next slide, please, Lauren. Thank you so much. Across England and Wales, we can see that there were more households that didn't identify anybody who had a disability, so 67.6%, compared to Birmingham, where that number was 65.5%. On the other hand, Birmingham had more households with either one or two or more disabled people there, with 26.5% of households with one disabled person and 8% of households with two or more people identifying as having a disability, which is higher than across England and Wales, where that was 25.6% and 6.7% respectively. Next slide, please. Thank you so much. In terms of types of disabilities reported, this data comes from the Family Resources Survey for the year 2021-22, and we can see that the highest proportion among children was a social behavioural impairment. Among working age adults, it was mental health, and among state pension age adults, it was mobility. And so that's a kind of nice link with Ellie's slides on age, how we can see different disability impairments kind of affecting people across different ages. I should note here that the percentages don't round to 100. Respondents could select more than one impairment. Next slide, please, Lauren. It's important that I'm just going to run through a couple of examples of reasonable adjustments, which can help ensure people with disabilities or long-term conditions are not substantially disadvantaged. So, for example, at work, employers are required to make reasonable adjustments such as physical changes, an example being installing a ramp, or process changes, an example being altering the recruitment process. Another example might be that somebody can have a desk to themselves rather than hot desking. So there's lots of different things that employers can do to meet the needs of their employees. Next slide, please. In healthcare, there's also a requirement to make sure that healthcare services are accessible to people with disabilities. And one example is providing appointment letters in Easy Read, which is a form of accessible communication that may suit, for example, people with learning disabilities, or longer appointment times for people who may need a bit more time to understand information. And other examples may include making sure that hospitals are wheelchair accessible and things like that. Next slide, please. So why is disability important to collect information on? Well, I'm just going to run through a couple of examples. So the first is employment. Fewer people with a disability are in employment compared to people without a disability, and we can see that the percentage on screen, there's quite a big discrepancy, so it's 53.2% compared to 81.8%. People with a disability who are working are more likely to be working part-time, so 34% compared to 23% of non-disabled people. And among people with a disability who are in work, the impairments with the highest proportion was depression, bad nerves or anxiety, followed by musculoskeletal problems such as problems with the back or neck, leg or feet, and arms or hands. Next slide, please. In education, there are also inequalities. So fewer people with a disability had a degree as their highest level of qualification compared to people without a disability, being 24.9% versus 42.7%. And more people with a disability had no qualifications at 13% compared to people without a disability at just 4.6%. My final example about inequalities is around housing. So people with a disability are less likely to own their own home, only 42% compared to 53% of non-disabled people. And there's huge inequalities within the umbrella of people with disabilities. So people with severe or specific learning difficulties were the least likely to own their own home at just 4% compared to people with disabilities in general. And the second lowest proportion was among people with mental illness or other nervous disorders at just 17.5%. Next slide, please. So the importance of collecting disability is hopefully really clear, and similarly to Amy and Ellie's slides, this one kind of shows how a person-centred approach and service improvement can be supported through measuring disability. So collecting data on disability can support a person-centred approach. It can support the tailoring of interventions and to meet the diverse needs of service users. And measuring disability can help identify and address health disparities. Collecting data can help us to monitor and evaluate the quality and effectiveness of our services. And the data can be used to design and implement policies and programmes to support health, equity and social justice. Thank you, Lauren. So in terms of collecting this data, we will be asking the question, do you have any physical or mental health conditions or illnesses lasting or expecting to last 12 months or more? If yes, then we'll be asking people to specify, or other options are no or do not wish to answer. For those that do select yes, we will be asking a couple of further questions. If you could just move on, please, Lauren. Thank you so much. So the first is about the types of difficulties people are experiencing. So difficulty seeing, hearing, walking, and that's to really gather that extra information. And the second one of those additional questions is about the extent of the difficulty and the impact on day-to-day activities. So a little, a lot, not at all, or again, do not wish to answer. We will also be asking a question around neurodiversity. If I could just ask you to move on, Lauren, thank you so much, which we understand doesn't equate to a disability. Some people with a neurodiverse condition may have a disability, some may not, but we will be asking this question as well, because it's really important to understand the needs of those taking part. So there's a question about whether the person has a diagnosis which sits under the umbrella term neurodiversity, and if yes, then to tick those that apply from that list there. And I should also state that it's quite important to consider the needs of those completing these questions. So whether the people, those taking part and those that will be filling out this questionnaire and using this toolkit may need some reasonable adjustments themselves, perhaps the questions in a different format and that kind of thing. So just something to consider. Next slide, please, Lauren. And some other considerations are that, firstly, the type of disability is important. We want to kind of understand the needs of those kind of completing our questionnaires. In terms of census data, the 2011 census didn't collect data on the type of disability. The 2021 did, but we don't have the data. I don't think it's been released yet. And finally, it's just important to note that capturing data on disability is really important, but it may not capture kind of all conditions impacting on a person's well-being if there are other conditions or illnesses which don't meet the criteria for a disability. So further questions may be kind of important to consider whether they're needed or not, depending on the kind of purpose of the questionnaire being taken place. So I'm going to pass back to Lauren now